Well, good day to everyone joining us and welcome to today's X-Talks webinar. Today's talk is entitled Patient-Reported Outcomes to Assess Long COVID, a review of existing tools and benefits. My name is Ryan Muse and I'll be your X-Talks host for today. Today's webinar will run for approximately 60 minutes and this presentation includes a Q&A session with our speakers. At this point, I'd like to thank Mapi Research Trust, who developed the content for this presentation. Mapi Research Trust is a nonprofit organization that facilitates access to clinical outcome assessments, COAs, for the entire scientific community. With more than 30 years of experience in the field of COAs and with the online platform eProvide, which includes databases on COAs, ProColid, Claims, ProLabels, and Guidance, ProInsight, Mapi Research Trust is the preeminent source of information on COAs. Now I would like to introduce our speakers for today's event. Sarah Carvalho manages a team of experts in consultancy in COA strategies at Mapi Research Trust. She has worked in a wide range of therapeutic areas, including oncology, cardiology, and infectious and inflammatory diseases. She has authored manuscripts and published in scientific peer-reviewed journals, as well as presentations for international scientific conferences. Sarah holds a PhD in cancer research from the Institute of Cancer Research, a master's in cellular and molecular biology, and a master's in clinical trial and medical affairs. And Nadine Kraft is the team lead of Mapi Research Trust's database unit. Prior to her work at Mapi Research, she was complementing her studies working at an international medical technology company. Graduated with a Master's of Science in Psychology and a specialization in cognitive neuroscience and psychological diagnostic, including psychometric properties. But now, without further ado, let's go ahead and hand things over to our Nadine Kraft. Nadine, you may begin when you're ready.
Thank you, Ryan, for the introduction, and welcome to everyone to our webinar, also from my side and Sarah's side. Sarah and I will present you a review of existing tools to assess long COVID today. I would like to start with a big thank you to the two very supportive teams and the people involved in this project. To give you a brief overview of what to expect today, I will show you the key learning points. We want to show you the importance of patient-reported outcomes in long COVID due to existing challenges faced by clinicians and patients, how the Mapi Research Trust expertise can support in the PRO field, and specifically through our patient-centered endpoint intelligence team. And we will go into details of a review containing 3 main information sources, presenting you a gap analysis on concepts measured by the key PROs relevant for long COVID. And with this, I would like to come to our first poll so that we all get a brief overview of today's audience.
Yes, thank you. So appearing on everyone's screen right now is a polling question. The question we're asking is, have you already worked in a study on long COVID? You can participate in this question by selecting on any of the answers that you see in front of you and then clicking submit. The question is, or again, have you already worked in a study on long COVID? Your answer options are a yes in clinical research, yes in commercial research, yes in academic research, or no, I have not. Looks like most of you have gotten your answer in, so thank you so much for participating. Let's take a look at where your results are. We have here 32% for yes in clinical research, 7% for commercial research, 15% for academic research, and then 46% saying no that you haven't yet. So thank you again for participating, and Nadine, it's back to you.
Thank you. Thank you all for participating in this brief poll to give us an overview who is participating today. To get into the topic, we will start by exploring long COVID. We are confronted with different definitions, as for example, coming from the MESH, Long COVID Europe, and the World Health Organization. The MESH, which we are using to classify our own databases, describes the post-acute stage of COVID-19 as persisting symptoms like fatigue, dyspnea, and memory loss. And here I just want to mention that we will refer to long COVID throughout this presentation today. Long COVID Europe is adding a more detailed time frame with symptoms persisting longer than 12 weeks without detailing these symptoms further. The World Health Organization specifies that new symptoms need to appear 3 months after the initial infection and last at least for 2 months. You can see that these definitions have a common ground but differ in their details, which is reflecting uncertainties we are still facing with this disease. Therefore, also exact numbers of those living with long COVID are uncertain, and estimating the prevalence of long COVID worldwide has been challenging. Nevertheless, studies show that around 10 to 20% of people infected by SARS-CoV-2 may develop symptoms that can be diagnosed as long COVID. In the US, as of January 16, 2023, 15% of all adults reported having had long COVID symptoms at some point, and 6% reported current symptoms. In a meta-analysis of 194 studies, mainly conducted in Europe or in Asia, it was shown that 45% of COVID-19 survivors, regardless their hospitalization status, were experiencing a range of unresolved symptoms at around 4 months. In the World Health Organization European region, it is believed that more than 70 million people may have experienced long COVID during the first 2 years of the pandemic, so in 2020 and 2021. There are also certain factors that are believed to contribute to the likelihood of developing long COVID, as for example, pre-existing health conditions, the severity of the COVID-19 illness, lack of vaccination prior to the infection, multisystem inflammatory syndrome during or after COVID-19 infection, as well as health inequalities. Still today, some clinicians do not recognize the disease, which means that patients can have difficulties in being believed, correctly diagnosed, and treated. We can concretely see that currently there are no drugs approved by the FDA or the EMA for the treatment of long COVID. But then obviously it is important to note that as more evidence on long COVID emerges, the management and treatment strategies may evolve accordingly. The primary aim for the patients will be to enhance their overall functioning and improve their quality of life. So now, why are patient-reported outcomes key for this? Because they help to consider and to understand the patient's voice and the impact of the disease on their quality of life through the objectiveness of well-developed and validated instruments. And by understanding the patient's needs, the development of specific and patient-centered treatment is supported. So we just spoke about patient-reported outcomes, and I would like to add a little recap of the different types of clinical outcome assessments that can be used. So what are clinical outcome assessments? According to the FDA definition, a clinical outcome assessment, or a COA, is a measure that describes or reflects how a patient feels, functions, or survives. And as I mentioned just before, they allow to measure the impact of a disease or treatment on the patient's quality of life. The FDA defined 4 types of COAs. Patient-reported outcomes, or PROs, are completed by the patient regarding their own health status. Observer-reported outcomes, or OBSROs, are completed by an observer of the patient, and most of the time this will be a parent or a caregiver. Clinician-reported outcomes, or CLINROs, are completed by a clinician or any other healthcare professional based on their observation of the patient. And finally, performance outcomes, or PERFROs, which are completed by an interviewer based on tasks that the patient is asked to perform. And after this little recap, we would like to come to our second poll question to understand which COAs you already used.
Yes, appearing on everyone's screen right now is our next polling question. This time we're asking which clinical outcomes assessments, COAs, have you already used in your own work? Your answer options are patient-reported outcomes, observer-reported outcomes, clinician-reported outcomes, performance outcomes, or I have not used COAs yet. As with the previous question, consider your answer, select one of the answers in front of you, and then click Submit in order to participate. Again, the question is, which clinical outcome assessments have you already used in your own work? Looks like most of you have submitted an answer, so thank you so much for participating. Let's look at where your results have come in. We have 79% for patient-reported outcomes, 2% for observer-reported, 5% for clinician-reported, 5% also then for performance outcomes, and then 9% of you selecting that you have not used COAs yet. So again, thank you so much for participating, and Nadine, it's back to you.
Thank you, Ryan. And as we all saw, the majority of the people attending today, they were using PROs already in their research. So what we will do now is that I will guide you through our methodology to identify gaps and select fit-for-purpose PROs. First, we want to look how Mapi Research Trust can help to facilitate the access to PROs. With more than 30 years of experience as a nonprofit organization in the field of clinical outcome assessments and patient-centered outcomes, we build a comprehensive expertise in each step of the patient-centric endpoint strategy. We have a very close collaboration to core developers, support in the licensing process, as well as providing eCore solutions. And additionally, we provide large core databases, which we complement with our patient-centered outcome intelligence. We will be zooming a bit into the patient-centered endpoint intelligence to understand which process can be applied by expert in a core landscape analysis. Starting by understanding the concepts that are relevant for patients suffering from a disease, we would then be looking into endpoints of ongoing or finalized clinical trials. Here we can analyze which instruments were used in the past and are currently used to measure relevant concepts. And this will be finalized by taking regulatory opinion into consideration and checking instruments for their development and validation to provide strategic consultancy. Now we will see which sources can be used for this. So there can be, for example, biomedical literature, the screening of clinical study registries, going through regulatory documentation, the analysis of the data from the eProvide core databases, and we will understand this source better in the next slide. Additionally, we have in-house scientific documentation with detailed information on cores and in-depth information from established relationships with developers and copyright holders, and we can go through other publicly available sources. So here we see some of our internal sources, the eProvide database, and I will provide you with more details on what information can be found to optimize the search for your fit-for-purpose core or PRO. In Pro Labels, you will find labeling claims for products approved by FDA and EMA, containing concepts that are measured with clinical outcome assessments. In Pro Insight, you will find recommendations and mentions of concepts to be measured with clinical outcome assessments for therapeutic indications by a broad range of health authorities. And in ProCollit, you will find the detailed descriptions of the instruments, including the concepts measured, which are validated clinical outcome assessments that were mentioned in labeling claims or guidelines, and many additional instruments. So what did we concretely do to understand the current landscape of PROs in long COVID? There was a review of qualitative studies from Medline and PsycInfo databases and the extraction of the most relevant concepts for long COVID patients. Next was a review of peer-reviewed publications in long COVID from Medline and ongoing clinical trials registered in clinicaltrials.gov. Followed by the extraction of the PRO concepts described and the instruments that were used to measure these. In the scientific database ProCollit, we identify PROs developed in long COVID. And next was the gap analysis to assess the coverage of concepts that were identified in step 1 by the most frequently used PROs that were identified in steps 2 and 3. Last, there was a brief review in the scientific database ProInsight to identify guidelines and recommendations from regulatory agencies and HTA for long COVID research and management. And now I would like to hand over to Sarah to show you the results.
Thank you, Nadine. I will now speak about the qualitative part of this project. As previously described, to understand the impact of long COVID in the patient's life, we reviewed 11 qualitative studies retrieved in Medline and the PsycInfo databases. This slide shows you the signs and symptoms from long COVID that affect the patients the most, such as fatigue, physical and mental exhaustion, brain fog and cognitive impairments with impaired concentration and memory, and confusion, headaches and migraines, the well-known and widely attributed to COVID-19 symptom, the changes in sense of smell and or taste, and cough, shortness of breath, palpitations and/or tachycardia, pain, and decreased physical strength, ability, or coordination. The wide range of signs and symptoms that we just saw does also have a vast impact on the patient's quality of life. Here, we highlighted the main concepts that influence the daily living of the patients that suffer from long COVID. In general, there is a sense of loss of the previous life with the perception of being healthy, fit on the pre-COVID time. The illness journey is long, with an unpredictability of varied symptoms and of recovery, with the patient often feeling confused, forgetful, and with difficulties in processing information. There's a physical debilitation and weakness that reduces their physical abilities and stamina. In the emotional side, there's a constant anxiety and worry, and a persistent fear of triggering symptoms leading to frustration and stress. Also, the activities of daily living are widely impacted, with some patients needing help with normal day-to-day tasks and to decrease and adapt the amount of activity to save energy. All of these have an impact on social and family functioning and the patient's ability to work. We will change now for the quantitative part of this project with a review of the PROs in long COVID. For the identification of patient-reported outcomes, we usually review the data in these three places. First, our own database, ProCorrelate, previously described by Nadine, where we search for and identify PROs developed in long COVID and have the detailed descriptions of the selected instruments, including their concepts measured, their development, publications, and validation, if available. This database is also a great source for newly developed instruments. Second, the Medline database, a database of biomedical literature from NIH, where we search for published clinical studies in long COVID patients and retrieve the information on the PROs used in these studies. And last but not least, clinicaltrials.gov, the NIH registry of ongoing or finalized clinical studies, where we search for the PROs used in recent clinical studies in long COVID. As they are recent, these are studies that have not yet been published. Therefore, all this information retrieved in all these databases is complementary. To date, in ProColid, we can find 8 instruments specifically developed in long COVID, measuring symptoms, functional limitations, overall health, disease impact, and our quality of life. We have from the post-COVID-19 functional status scale, symptom burden questionnaire scale for long COVID, COVID-19 Yorkshire Rehabilitation Scale and its modified version, the long COVID symptom tool, the long COVID impact tool, functional compass, COVID-19, and the post-acute COVID-19 quality of life questionnaire. And some of these just are actually distributed by Mapi Research Trust. Just a quick note on the next few slides. As we previously said, we are only focusing on the PROs described in the studies found in Medline and CT.gov. On Medline, we found 139 studies, and on CT.gov, we found 57 studies to the date that we performed the analysis of this data. So the list of long COVID PROs, so PROs specific developed for long COVID, we have that were found in Medline and in CT.gov. We have the previously described post-COVID-19 functional status scale and the SQBQ-LC, the symptom burden questionnaire for long COVID, together with the COVID-19 Yorkshire Rehabilitation Scale and the long COVID symptom tool and the impact tool. Then we went and also looked at the generic PROs, so overall PROs that are not disease specific, and we found that the main ones used were the SF36L survey, the Iroquois 5D, and the Borg dyspnea scale, the FS12 health survey, together with the PROMIS 29 profile. So these are the top 5 generic PROs found in both of these registries. Then for the other disease-specific PROs, we found the Hospital Anxiety and Depression Scale, the Modified Medical Research Council Dyspnea Scale, the Fatigue Severity Scale, the Generalized Anxiety Disorder, and the Patient Health Questionnaire 9-item. As you can see, these are all being widely used in these long COVID studies. So this slide shows the 2 most commonly used instruments from each category previously presented, the long COVID specific, the general and other disease specific PROs, crossed with the most important concepts from the patients, from their perspective, from the qualitative review. So in here, we reviewed the concepts measured in the studies from the Medline and clinical trial registries with the PROs, PCFS, BQLC, SF36, EQ5D, MMRC dyspnea scale, and the HAD scale, and realized that most studies were mostly interested in measuring signs and symptoms, physical and emotional and cognitive functioning, and overall quality of life. And that the concepts related to the activities of daily living, social functioning, illness journey, experience, family function, and coping were less focused on. So we wanted just to do a quick summary and to give you the key takeaways of this webinar. As we know, long COVID is a new and heterogeneous disease of an uncertain prevalence due to complexities associated with diagnosis, which has a significant impact on all aspects of quality of life. Thus far, no questionnaires cover the totality of the concepts that are relevant to long COVID patients. Multiple instruments are used to cover several concepts. Nevertheless, in clinical studies, activities of daily living, social and family functioning are not commonly assessed. In addition, to date, no drugs have been approved in this disease, indicating that more research in this field is needed. We have one COVID-19 rapid guideline from NICE that mentions that managing of the long-term effects of COVID-19, it makes recommendations about care in all healthcare settings for adults, children, and young people who have new or ongoing symptoms 4 weeks or more after the start of acute COVID-19, and it recommends the development and validation of new and existing screening tools, including physical, psychological, and psychiatric aspects for post-COVID-19 syndrome in the UK population. The patient-centered endpoint intelligence services from Mapi Research Trust can support a review of the clinical outcomes assessments landscape in long COVID and the creation of a concept mapping and select for fit-for-purpose PROs. And with this, I would like to thank you all for your attention. We'll now answer some of your questions. Nevertheless, if you have any additional questions or requests for information, please do not hesitate to contact us in these emails.
Well, thank you very much for that very insightful presentation. I'd like to invite our audience to continue sending their questions or comments right now using the questions window for this Q&A portion of our webinar. Now, I've already received some questions from the audience, so we'll get ourselves started with those. The very first question that I have here asks, did you mainly find that working groups are concentrating on one PRO to measure several concepts for long COVID studies, or did they use several COAs?
Normally, there are several COAs used, that measured multiple concepts, but there are some gaps indeed of concepts that are not being studied. But yes, multiple PROs or COAs are being used in this type of studies.
Very good. Thank you so much. The next question is curious then, how often are you updating your internal databases? PQ every 3 months to check for COVID instruments or any change in labels or guideline within 1 month?
Yes, so in fact we can implement any things that come from the agencies in ProLabels and in ProInsight within 1 month after the agencies publish these changes. And generally we are checking all the publications for long COVID newly developed instruments once a quarter.
Okay, wonderful, thank you. So then next question here is curious, what is the importance of the frequency of different concepts that were identified as important for patients with long COVID?
Can you please repeat the question?
Yeah, it says, what is the importance or the frequency of the different concepts that were identified as important for patients with long COVID?
So if I understand correctly, the importance of the frequency is, so the frequency shows us how widely the PROs are used and how widely the concepts are monitored. It's interesting for us to see this to analyze and to see and to review what is being currently done in this research field.
Wonderful. Okay, thank you. So the next question's regarding search terms. What they'd like to know is what search terms were used to conduct the reviews.
So I don't have the exact strategic terms that we used. However, we do use, so for the qualitative part, we have the qualitative terms that we cross with the disease terms. And we had some limits such as population, such as timelines. And for the quantitative parts, we have in this case, we have patient-reported outcomes that we cross with the disease terms and the population and other limits that we need to see. So we grasp the majority of the studies that have this information.
Thank you so much for sharing that. So then another question is wondering, are mental health symptoms or outcomes being measured independently or as part of the long COVID scale?
It will depend on the scale used. There will be scales like, for example, the HAD scale, the Hospital Anxiety and Depression Scale, that will measure mostly anxiety and depression. But we also have scales such as, let's just go back. Apologies for the delay, but we have scales that, for example, they measure the overall quality of life that might include the emotional state as well, such as F36, EQ5D, but I would need to go more in depth to see exactly which ones will cover that.
Okay. All right, very good. Thank you so much. So I think at this point we are coming to the end of our time here for the Q&A session. I would like to direct the audience's attention, though, to the handouts module within the GoToWebinar control panel, where they'll find some additional documentation related to today's presentation to download for some further reading. I want to thank everyone, though, for participating in today's webinar. If we couldn't attend to your questions, know that the team at Mapi Research Trust will follow up with you, or if you have further questions, you can direct them to the email addresses that are up on your screen. You'll also be receiving a follow-up email from XTalks with access for the recorded archive for this event. A survey window will be popping up on your screen as you exit, and your participation is appreciated as it helps us to improve our webinars. I've also sent you a link in the chat box, and with this link, you'll be able to view the recording of this event on this page, and you can share this link with your colleagues so they can register and view the recording here as well. So I encourage you to do that. Now, please join me once more in thanking our speakers for their wonderful time here today. We hope everyone found the webinar informative. Have a great day, and thank you for coming.